Breast cancer is one of the most common cancers affecting women worldwide, and early detection remains one of the most powerful tools in fighting it. While regular mammograms and clinical exams are essential, performing self-breast exams at home can help you notice changes in your breasts early on. These exams empower you to recognize what's normal for your body and detect any unusual signs that should be checked by a healthcare professional. It's important to remember that not all breast changes mean cancer, but being aware of the symptoms and acting on them promptly can make a significant difference in outcomes. Let's explore the 12 key symptoms and signs of breast cancer so you know exactly what to look for during your self-breast exam. First and foremost is the most commonly recognized sign, a new lump or mass. Most breast cancers are discovered as a lump, often hard and painless, but some can be tender, soft, or even rounded. The lump may feel distinctly different from the surrounding tissue or from the other breast. Not every lump is cancerous. Many are benign, but all new lumps should be evaluated by a healthcare provider. When performing your self-exam, use the pads of your fingers to press gently in a circular motion across the entire breast, including the armpit area, to feel for anything unusual. Second, pay attention to any swelling of all or part of the breast. Sometimes swelling can occur even if no distinct lump is felt. This swelling may cause one breast to appear larger than the other, or it may cause the skin to feel tight or heavy. Swelling could be a sign of a more aggressive or inflammatory type of breast cancer, especially if it comes on suddenly. Don't ignore persistent swelling, even if it seems mild. Third, observe any skin irritation or dimpling. The skin of the breast may take on a texture that resembles an orange peel. This is called peau d'orange. It can occur when the lymph vessels in the skin become blocked by cancer cells. The dimpling or puckering may be subtle or pronounced, and it's most often noticeable when you raise your arms or move your breast. If you see any unusual puckering or changes in skin texture, make note of it. Fourth, look for pain in the breast or nipple. While most breast cancers do not cause pain, some do. Any new, persistent, or unexplained pain in the breast or nipple, especially if it's localized to one spot, should be evaluated. Many women experience breast tenderness related to their menstrual cycle, but cancer-related pain is usually persistent and not linked to your period. Fifth, take note of nipple retraction. If your nipple begins to turn inward or becomes inverted, this is a change worth investigating. Some women naturally have inverted nipples, but if you notice a new inversion or pulling in of the nipple, it could be a warning sign. Cancer can cause the ligaments within the breast to contract, pulling the nipple inward. Sixth, examine the nipple for redness, scaliness, or thickening of the nipple or breast skin. These changes can signal a rare form of breast cancer called Paget's disease, which often starts at the nipple and spreads to the areola. The skin may look flaky, crusty, or feel itchy, and the area may become tender or painful. Don't mistake this for simple irritation or eczema. If it doesn't go away, seek medical advice. Seventh, be alert to any nipple discharge, especially if it's clear, bloody, or occurs without squeezing the nipple. While many women experience benign nipple discharge, particularly if it's milky and related to pregnancy or breastfeeding, discharge that is spontaneous, persistent, or comes from only one nipple is more concerning. Discharge that is red, brown, or clear can indicate an underlying problem that needs evaluation. Eighth, notice any change in the size or shape of the breast. Over time, breasts can change due to age, weight fluctuations, or hormonal changes. But a sudden or unexplained change in contour, size, or shape of one breast compared to the other could be a red flag. Look in the mirror with your arms at your sides and then raised overhead to spot any differences. Ninth, check for a lump or swelling in the underarm or around the collarbone. Sometimes cancer can spread to lymph nodes in these areas before a lump in the breast itself is felt. If you notice a firm, tender lump in your armpit or above your collarbone, it should be checked by your doctor, particularly if it doesn't go away after a week or two. 10th, observe any visible veins on the surface of the breast that appear more prominent or swollen than usual. While many women naturally have visible veins, a sudden change, such as veins appearing larger, darker, or more prominent, can be a sign that the breast tissue underneath is under stress due to a tumor or increased blood flow. 11th, pay attention to any unexplained warmth, redness, or darkening of the breast. These symptoms may be associated with inflammatory breast cancer, a rare but aggressive type. The skin may feel hot to the touch, look bruised, or have a reddish or purplish hue. These symptoms are often mistaken for infection, but if antibiotics don't resolve the issue, prompt further investigation is critical. 12th, finally, be aware of persistent itching of the breast or nipple. While itching can be caused by many benign skin conditions, ongoing itchiness that doesn't improve with moisturizers or over-the-counter creams and is accompanied by other changes like redness, swelling, or thickening of the skin can signal something more serious. Now that you know the 12 potential symptoms and signs, let's discuss how to perform a thorough self-breast exam. Ideally, you should conduct the exam once a month, a few days after your menstrual cycle ends, when your breasts are least likely to be swollen or tender. If you no longer menstruate, pick a consistent day each month to perform your check. Begin by standing in front of a mirror with your shoulders straight and your arms on your hips. Look for any visible changes in the shape, size, or color of your breasts. Next, raise your arms and check for the same changes. Look for any dimpling, puckering, or changes in skin texture, and see if your nipples are in their usual position or inverted. After the visual check, use the pads of your 3 middle fingers to feel for lumps or thickened areas. Move your fingers in a circular motion, covering the entire breast from top to bottom, side to side, from your collarbone to the top of your abdomen, and from your armpit to your cleavage. Apply different levels of pressure to feel both the surface and deeper tissue. Don't forget to check the area under your arms and around your collarbone for any lumps or swelling. Finally, gently squeeze each nipple to check for any discharge. If you notice any of the 12 symptoms or signs, whether it's a lump, swelling, dimpling, pain, nipple changes, unusual discharge, or anything else that feels out of the ordinary, make an appointment with your healthcare provider. Remember, most breast changes are not cancer, but only a healthcare professional can determine the cause. It's also important to know your risk factors. Some factors, like age, family history, and genetics, can't be changed. However, lifestyle choices, such as maintaining a healthy weight, staying physically active, limiting alcohol, and not smoking, can reduce your risk. If you have a family history of breast cancer or carry genetic mutations like BRCA1 or BRCA2, talk to your doctor about more frequent screenings or preventive options. Early detection saves lives. By performing regular self-breast exams and being aware of the 12 key symptoms and signs, you are taking an active role in your health. If you spot something unusual, don't panic, but do take prompt action. Discuss it with your healthcare provider, who can guide you through the next steps. Your vigilance could make all the difference. Stay informed, stay proactive, and remember, knowing what to look for is the first step towards protecting yourself and those you love.